Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So this video is preferably for the nursing aspirants who are preparing for the competitive examinations. So today we are going to see the MCQs related to the subject fundamentals of nursing. So this is a self-assessment session. So the nursing aspirants can utilize this video by answering the questions, and we'll see who gets 10 out of 10 in their questions. Let's get started with the video. So the first question is, which of the following medication order is immediately and once only administered? So among the four options, which is considered as the medication order which is given immediately and also only once we have to administer. So option A is PRN order, option B stat order, option C single order, and option D standing order. So according to this questions, this is also a direct question. So PRN means when required we have to administer, whereas stat order means immediately and only once we have to administer. So the answer is stat order. So single order and standing order does not related to this question. So next is the slow infusion of isotonic fluid into subcutaneous tissue is called. Option A hypodermoclysis, option B plasmapheresis, option C dialysis, and option D enteroclysis. So according to this question, so the slow infusion of the isotonic fluid like NS or oral, it is being administered into the subcutaneous tissue. The correct answer is option A hypodermoclysis. So here what happens is, it is a method of rehydrating. So when the oral rehydration or intravenous fluid rehydration is not possible for the patient, in that cases what we do is we administer the slow infusion of this isotonic fluid into the subcutaneous tissues like thighs, buttocks, below the breast and scapulae. So this is known as hypodermoclysis. So next question is, potassium content of RL mmol per liter is. So here among the option, how much content of potassium is present in the RL? Option A 130, option B 109, option C 4, and option D 50. So with these four options, the correct answer is option C, 4 milliequivalent per liter. So for answering this question, we must know how much content of potassium and other components are present in the RL. So sodium is 130 milliequivalent per liter, potassium 4 milliequivalent per liter, calcium 2.7, chloride 108 milliequivalent per liter, and lactate 28 milliequivalent per liter. Sometimes in the questions what they will ask is like they will ask about sodium and calcium, chloride. So not only potassium they will ask, they will also ask other contents of the content that is present in the RL. Sometimes they will throw the questions like how much content calcium is present in RL, like that. So you have to know what are the contents that is present in the RL is. So next question, which among the following is a crystalloids? So option A WBC, option B plasma, option C RBC, and option D linger lactate. So among these four options, the WBC, plasma and RBC, it is considered as the colloids. So we have crystalloids and colloids. So crystalloids are NS and RL. Again, crystalloids are classified into isotonic, hypertonic and hypotonic. So among these four options, the first three options like WBC, plasma and RBC, it is considered as a colloids. It does not come under crystalloids. Whereas the option D, linger lactate, it comes under crystalloids. So next question is, a fire breakouts in the ward. The first action you take is, so when we are facing in a ward, there is a fire is being broke out. So among these options, what is the foremost option we will do it? So the first action you take is, so for option A, call 101 fire brigade, option B, shut off the oxygen supply, option C, do use the fire with fire extinguisher, and option D, evacuate the patient from the ward. So whenever we are seeing the questions related to fire, we have to keep in mind the mnemonic RACE, R-A-C-E. So in that RACE, RACE, R is rescue and remove the client. So in this 4 options, which is the first action we have to do is, according to that mnemonic, R means remove the client or rescue the client. So here the option D is correct answer, that is evacuate the patient from the ward. So I will tell you what that mnemonics RACE is. R is for rescue and remove the client, A is for activate the alarm, C is for confine the fire by closing the doors and windows, and E is extinguish the fire with the help of fire extinguisher. So this mnemonic we have to keep in mind, and among these 4 options, which is the foremost action we will do it when we are facing the fire in the ward. So it is very clear by the mnemonic. First we have to evacuate the patient from the ward, that is rescue or remove the client from the scene. Next question is 1 ounce is equal to, so sometimes they will ask in ml and sometimes they will ask in teaspoon. So here the question is 1 ounce is equal to option A 2 teaspoon, option B 4 teaspoon, option C 5 teaspoon, and option D 6 teaspoon. So it is also like a direct question. So 1 ounce is equal to how much teaspoon is, like 6 teaspoon. So the correct answer is 6 teaspoon. So next we'll move on to the next question. Which of the following is a preferred site for IM injection in infant and children? So the option A is deltoid, option B rectus femoris, option C vastus lateralis, and option D ventrogluteal. So the answer is vastus lateralis. So mostly for the infants and children, the preferred site for IM injection is vastus lateralis. So for the infants and children, we don't go for the other IM sites like deltoid or ventrogluteal. So we oftenly go with the vastus lateralis, that is in the thigh. So next question is, the medication error occurs when nurse, option A, is caring for too many clients, option B, fails to follow the routine procedure, option C is administering unfamiliar medication, option D is responsible for administering numerous medications. So here according to this question, how often the medication error can occur for a nurse? So here the correct answer is option B, fails to follow routine procedure. So other procedure, it means that it is the incompetency of the nurse towards the profession. It resembles like that. So we should not choose those answers. The correct option is fails to follow the routine procedure. If a nurse fails to follow the routine procedure, there is a chance the nurse can end up with the medication error. So next question is, to calculate the dose of a medicine for a child, which of the following formula is used? So for calculating the medicine dose for the pediatric population, what all formulas will be used? So option A, Young's formula, option B, Clark's formula, option C, Freud's formula, and option D, all of the above. So here for the pediatric population, we use all these 3 formulas, that is Young's formula, Clark's formula, and Freud's formula. So Freud's formula is used for the children below 1 year of age, that is when they will be in 5 months, 6 months or 10 months, no. So when the child is below 1 year of age, we will use the Freud's formula. The formula is age of child in month divided by 150 into adult dosage. So next is Young's formula. Young's formula is used for the children between 1 to 12 years of age. And Clark's formula, it is used for the children if we don't know about their age, we can calculate the dosage by the weight of the child. So the Clark's formula is weight of the child in pounds divided by 150 into adult dosage. So according to this question, all the formulas we will use for the pediatric population to calculate the drug dosage. So the next question is, high concentration of oxygen administered into newborn or a premature infant may cause the complications like. So what are the complications arises for the newborn or the premature infant when we are giving the high concentration of the oxygen? That is, what are the oxygen toxicity we'll see. So option A, retrolental fibroplasia, option B, respiratory failure, option C, retinal detachment, and option D, polycythemia. So according to this question, the oxygen toxicity is within these 4 options, the only option that is high concentration of oxygen if we are giving means the complication is option A, retrolental fibroplasia. So to make you confusing, they have given option C, retinal detachment. So retinal detachment does not come for the complications of the high concentration of oxygen. So among these 4 options, the retrolental fibroplasia is the correct option for this question. So that's all about the nursing foundation questions. If you have any doubt, kindly drop down in the comment box. If you find this video to be useful, kindly like it, share it and subscribe it, and comment me those who all got 10 after 10 questions. If you are above 6 or 7, that means you are preparing well for your competitive examinations. Thank you for watching the video.